Well, welcome. Today, I'm very excited to have on our show Dr. Michael Putman, who's out of the Sacramento, California area. Is it, what's the name of the city?
Roseville.
You've been a chiropractor 32 years, is that correct?
Close, like 1994, so 20.
Oh, same as me. You just look better. That's right. And pretty exciting, Mike. I met you, 10 months ago or so. You came through, you kind of raised your hand and said, Matt, I want more information about this futuristic device, the Softwave technology. And, I sent you some information and you tell the rest.
Well, it just made so much sense to me right out of the gate. I was talking to another doctor in Laguna Beach who has it. He was telling me some fabulous stories. And I'm like, what are you talking about?
That's Dr. Hank Williams down in Laguna Beach.
Yes, Hank Williams, yep. And so, so the more research I did on it, the more excited I got about it. I mean, my whole practice is, high touch, high tech, hey, whatever makes sense and has some documentation and research back it, we try to incorporate into our treatments and our plans. And so, I was on board almost immediately. I think that,
Yeah, you did. I love that you made that decision. And I was lucky enough to be able to fly out, meet your team. What a great team you have. Just one of the most beautiful offices. I remember we were looking at a family of deer running around between presentations. And I mean, we just had, really, when we set up these training days, we say, Doc, get all those patients that, have been loyal to you, but still have underlying issues that conservative care hasn't helped. And we lined them up. We must have done 14 or 15 and then a couple extra at the end. And we just had great day and great videos. And just really, I mean, the cool thing about this is it's reproducible. We place this in close to 300 clinics across the country now. And there's predictable patient outcomes that I like. And it's very user-friendly. You felt proficient in it right away, correct?
Yeah. And I have 4 staff members that are technicians as far as we're concerned using it. And everybody feels comfortable with it. Everybody's confident with it. And, everybody's excited. I mean, especially, lately, we've been super excited.
Yeah. I mean, and by the way, being in practice for 27 years, you see some miracles, but it seems with this device, it's like every other month we find something else that this device has a positive biological effect. So you have a really special story, and then the patient is John, and I know we will have them on the next time so you can introduce them, but John has a really great story. He came in through your clinic, and I'll let you take it from there, about 3 or 4 weeks ago.
He came in, probably maybe a little bit longer than that. He came in, they live in Hawaii. He's a pharmacist. He has a PhD in pharmacology. And he came in because he was having severe sciatic pain. And he was in a wheelchair. The interesting thing about John is that he's a super smart guy, but he's had dementia for a long, long time. His wife said since 2011. So he was really non-communicative when he came in. The only way we knew that he had pain is because his wife would tell us he's in severe pain, not right maybe in this moment, but he has, episodes of severe pain. And their daughter happens to live in our area. So she did some research, found us, told them about it, and they, made the commitment, came out and spending, months out here to try to get well. And so we do a lot of spinal decompression, and as you know, and as soon as I got the Softwave, I started incorporating that in my spinal decompression protocols. And, especially I started using it on patients that were slow to resolve. They might have, some remnant sciatic pain, and we started using it and seeing, people were just getting so much better immediately. And going, hey.
Just for some of our listeners who don't know what Softwave tissue regeneration technology is, this is genuine lithotripsy, same technology they've used for 40 years to break up kidney stones. They use electrohydraulically produced supersonic waves that when pointed at an area creates a positive biological effect, decreases inflammation, decreases pain, improve circulation.
Mm-hmm.
So you're using that, you're seeing that it magnifies the results of some of your other therapies you're doing. Patients getting great results. John, who is coming in, was nonverbal. He couldn't feed himself.
Non-ambulatory.
Non-ambulatory. He was in rough shape, and
he was full care. I mean, it took 3 of my staff members to get him on the spinal decompression table. 3 people lifting, moving him to get on.
Dead weight.
He was, you know, as you'll see, he describes himself as a blob. So we did Softwave on him the first couple of times.
Low back.
On his low back, right? And immediately it dampened the pain. And then we would follow that up with decompression. And over a period of literally a week or 2, he was 50%, 60% better, you know, so, which is amazing, obviously. And his wife was thrilled. And his wife she comes in one day and she goes, "Hey, would that Softwave work on my knee?" And I go, "Well, you know, what's going on with your knee?" And she has some arthritis and, you know, swelling and pain and all. And it's like, yeah, well, the goal of Softwave is to reduce inflammation, you know, to break up adhesions and scar tissue, to help with pain. And so we should try it. And we did. And amazingly, it helped right away.
What is her first name?
Bernadette.
She's beautiful. Yeah. So
yeah,
she gets good results, comes back and says, "Hey, what about my husband's head?" Yeah.
She comes in, it's because I have a big poster in my entryway that you made. And it talks about mitochondria and has one of the arrows pointing to the head. You know, she saw that, and she goes, "Can this work with his dementia?" I'm like, "Well, Bernadette, you know, it's not FDA cleared for brain stuff yet. There's a lot of research going on, but you know, it's not FDA cleared." She looks at me, she goes, "Neither was that shot I just took." And I'm like, "Okay, well, that's a fair point."
Bernadette, yeah.
Yeah, and then I contacted you, and
and I told you that this had recently been cleared. This technology had recently been cleared in Europe for dementia and Alzheimer's.
Right.
And you know, this has also been labeled in non-significant risk factors. So there's not a lot of side effects. And the one thing I said, we call it less is more protocol. I gave you a screenshot of what I wanted you to use the settings at. Yeah. And also I said, before you do anything, make sure we get an MRA. It's a magnetic resonant imaging of the arteries of the brain.
Right.
Guess what? What'd they do?
Yeah.
They went and got it.
Yeah. Yep. And there's, you know, they were, my thing is like, hey, I don't know if this is going to help you or not. What I do know is what this technology does. It reduces inflammation, it increases blood flow. That's got to be good for the brain because the brain needs oxygen and glucose to be healthy.
Yeah,
you know,
and let's talk about the root cause of a lot of what is a silent killer in a lot of people is inflammation, and understand that the amyloid plaque that builds up in the sulci of the brain is from how our body deals with toxins and inflammation in our environment and in our body. Right. And so the thing that I love about this device, and I say it, I've said it for years, this is probably the most versatile medical device that we've seen in our lifetime.
I think so.
We have multiple studies now that show that we help release what's called an innate immune receptor, which is TLR3, toll-like receptor 3, which has been shown to downregulate inflammation, turning down that process, allowing your body to heal, repair, regenerate. So then you got this. You also have family sign this. We can pull up some of this too.
Form. I contacted again you guys and just said, hey, what kind of form can I use for this, just to make sure that they're informed that this is we don't know. There's not a lot of background on it. So I just wanted patients to know that, hey, there's probably no risk, but we don't know. And so I got this form that's called a compassionate use, emergency use form, because it could be used for things like dementia that have no really treatment to fix it, nothing to help. And so we had them sign that form, and it just explains clearly that, that this is under investigation, but we're not part of the investigation team. But because of the condition there's nothing that we can do to help it, it allows us to try something like this. And so they were on board. I mean, she wanted me to do this out of the gate, and
hey, you know what? It's a great story. I'm going to show the first clip from one of the first times you worked on him.
Right.
By the way, my mom passed away 2 years ago from dementia. Wow. It's a terrible disease. Yeah. Dementia Alzheimer's. We meet cancer survivors every day. You really never meet a Alzheimer's survivor. And there's a great book by Dr. Dale Bredesen that talks about, puts this into like how many people will have this in the next, in our lifetimes. And basically there's been over 600,000 people that died from COVID in the United States. And that's a pandemic, a world pandemic. Right. But Dr. Bredesen and other experts predict that of the current 330 million people that are alive, 45 million of them will die from Alzheimer's.
Yeah.
And if we don't find something, this could be, it could bankrupt our world healthcare system. So, there's so much time. This is 24/7 my mom needed, and I'm sure John had something similar. So let's show this first part.
Let me give you a little background on this. This is the second visit I did. Again, in hindsight, I wish I started videoing right out of the gate, but who had any idea what was going to happen with this, So as I'm doing this Softwave treatment, I'm talking to his wife to ask her what kind of things they've seen change. Because the interesting thing is John, as we said, he's non-communicative when he comes in. And then I did the first treatment with this, and then they came back 2 days later, which is this video, and my staff goes, "Hey, go talk to John." I'm like, what? Okay. Yeah. So I go up to John, I go, "Hey, how's it going?" "Oh, great." So he's actually he's telling me he's doing good, and I look over at his wife, and she goes, "He went home that first day, and we got home to my daughter's house, and my daughter comes in to see me, and she goes, 'What happened to Dad?' And she goes, 'What do you mean?' 'He's having a conversation with me. He hasn't had a conversation.'"
How long has it been?
Years.
Come on.
Years. We have to get super clear about it, but it's years. It's
okay, here we go. Let's watch. This is a second treatment. Thanks for clarifying that.
Yep. Do you feel that at all?
Oh, yeah.
Okay. What's it feel like? Somebody's taking a hammer to your head?
Yeah, close to that.
Again, we're using supersonic sound waves traveling 3,355 miles an hour.
So what are you noticing difference-wise?
Oh, he's more alert. He understands me more when I give directions. Even getting him up and off the table. I mean, it's amazing how well he does.
Okay, good. And he's eating on his own?
Yeah.
Because you said you had to help him.
I had to feed him. No, I don't have to feed him. He uses his own fork and spoon. He's doing really, really well.
Okay, so we're doing a intensity of 5 at 2.0. 100 shockwaves here. I'm going to do a little bit more.
Then you went and did a little bit on the occiput as well.
Yeah, so my goal was really, we're talking about the occiput part of the skull, but I'm looking at the cerebellum in the back part of the brain, and in the front, it's the prefrontal cortex. That was my, there's a network of wiring between these parts of the brain that facilitate memory, facilitate higher functions.
Now, before he would just be there. Now he can actually.
After one treatment.
After one treatment.
That's pretty cool.
That was a super treatment.
Yeah.
Super treatment. Supernatural healing.
God, he's talking to us. I mean, literally.
I loved it. I was watching too.
Doesn't hurt at all, though, right, John?
No.
I was watching it live. I was loving it.
Yeah.
Getting those mitochondria activated in there.
It works on a cellular level, helping increase cell membrane permeability.
Yeah, I remember
We're gonna get your forehead cleaned off here.
that. Okay.
And then you do some on the
You don't need that
back.
goop.
Mm-hmm.
So the occiput, that area of the brainstem does not have a skull. For so many, for so many years, we weren't sure if these supersonic sound waves were reverberating or bouncing off the bone or skull. But now we know that there's a positive biological level that can get into the brain, and we see an energy level that creates positive biological effects. So very good. So that's that one. Let me go back here, and this is after the second one. And this is Bernadette.
This is Bernadette.
Wait, this is after that treatment. She comes in.
This is like probably another, maybe the third visit.
Okay.
I'm the same.
And now you're like, I'm gonna videotape everything. Let's
Yeah,
listen to what
exactly.
Bernadette says, because obviously she's been his caretaker for the last decade. And
Yes.
Okay, so,
He was diagnosed in 2008,
okay,
MRI, everything.
okay.
2011, it got so bad, they took away his driver's license. He almost couldn't function.
Mhm.
And so, well, you saw him. How he was
He's been like that since 2011?
No, it just got progressively worse.
Oh, okay.
Yeah, but, and, you saw him, how he was
Yeah.
and everything, and look at him now. He's just amazing. My family's happy, we're happy.
Nice.
And I'm happy.
Are you happy, John?
Yeah.
Do you notice the difference?
I was really worried for a while.
Were you? Yeah. Yeah.
Yeah.
Do you remember last week, he told you I finally got my independence?
Yeah.
Yeah, he went home and told my daughter Kainoa, he says, yeah, me and the doc were talking, I got my independence. So he
I'm going to stop it right there for a second, because, I said, is this the first patient with dementia and Alzheimer's to come back? Like,
Yeah.
this is the first one we ever meet that we get to
Yeah.
interview. Like, you're interviewing. This is amazing. And it's like they get to the edge of this, Dante's Inferno, and they're going down this labyrinth that no one has ever come out of. And this is like a near-death experience, to be honest with you.
I mean, I don't know if I haven't heard anybody else telling what it was like to be there. So
I mean, it's pretty cool.
I'll tell you one thing.
Great.
Go ahead.
That's really cool. It's his eyes. I mean, and his wife will comment on that, but it struck me that second day or third day I saw him after this, his eyes were bright. And I mean,
He was a shell, right? He was just there.
yeah. And they were so bright, Matt. I mean, it was just amazing. It was something it just jumped out at me. It's like, wow, what is that? What happened with that? I love him. Look at him.
Yeah, that is beautiful. I'm going to go back to my library quick and show you this. My daughter, Emma, was so nice to put together a reel, which is basically the three compilations of the second, third, and fourth treatment in your interview. This has got over 8,000 views since we posted it last night. I mean, it's a pretty cool story.
Yeah.
Thank you for documenting it. And really, it starts with one. It starts with one patient. And if we've made a difference, I've always said, I might not get to heaven, but with this device, we can bring a little heaven to earth. And that's what we're doing for this family. And
Take
great
a
job.
person like that. I mean, and absolutely change their lives. Absolutely change their lives. Have your dad back, Matt. Have your mom back.
Like most people, like, who would you ever want to have dinner with? It's like my mom and dad. Like, it would be so cool just to. But
he was gone for them. As far as he'll tell you he was a blob there. He wasn't there. Now
wait a second. He shaved his beard, Johnny. Look at him. All right, here we go.
Yeah.
Here we go. This is from yesterday.
Yeah.
Here with John and Bernadette. And so I just wanted to kind of take a minute and talk about what's happened in the last couple of weeks, because it's kind of remarkable. We want to make sure we're documenting it. So can you give me just, one of you, both of you, give me a little synopsis of what, what's happened
Since or before?
before and then since?
Okay, so before we come here, John, we call him Papa, had a hard time eating by himself. He couldn't dress himself. What else he couldn't do? He didn't articulate anything to us. He was just there.
Mm-hmm.
And then my daughter told me about you in this place, and we came here for his stenosis.
Mm-hmm.
And then we talked about the Softwave, and we started him on that therapy. And since then, look at him. Look, his eyes are bright. He knows when, we can have conversations now. He feeds himself, he dresses himself. It's just amazing.
How's it feel for you?
It was great.
Yeah. Do you remember what it felt like before, or?
Yeah, I felt like the great blob.
Yeah, and you can consciously know that?
Yeah.
Uh-huh. Because I was talking to them and they were going like, there's not too many people, if any, that have come back from that to know, what people experience when they're feeling like that, or if they experience anything, or if they recall anything. So it's just it's a profound question. So now you feel what?
Well, I feel pretty happy because I know what's going on.
Yeah.
And when I talk to people, whatever it may be, it's quick understanding. Before I was just kind of out there, thinking around, and
yeah. And I mean, it seems like almost every day you're getting better.
Yeah, I think so.
Yeah, good.
I also found before, when I would drive, he was just in a passenger seat,
Mm-hmm.
and he would just be there.
Mm-hmm.
And now he'll say, the light's green, why aren't you going? And I go, whoa, but before he wasn't aware of our surroundings.
Yeah.
And now, just little things like that where he's catching on.
Yeah, I mean, I just feel like this is a great case study that we're gonna be looking at for the next while, hopefully for a long while, so I just want to let you guys appreciate, that I appreciate you being willing to kind of let us spot a video and document it. I wish I did it right out of the gate.
I know, when he first came in.
Yeah.
But you saw him when he first came in, just for his stenosis.
Well, Dr. Lewis was reminding me that, what'd you say? He was like,
there's some exams that we could do just to see the cognitive function and how they increase, and just kind of test it out from where he is now. We could even do it now and to where he can progress to, and just
also
document it.
like for, kind of quantifying Alzheimer's deterioration and things like that, or dementia deterioration. So good, great. Thank you for the time for doing this. Appreciate it. Now we'll get on with our stuff.
Okay, I'm trying to stop sharing. Is that happening? Okay, there we go. I mean, it's in their own words. That's what's the most beautiful about it, Mike and Dr. Mike. Really, so grateful. I think I told you a while ago, we clicked on our first Zoom meeting and I was like, dude, I need 100 more doctors just like you, because you got it. And, people don't get behind missions, right? Or causes, they get behind the people that are moving it. And so thank you for being on this mission with me. And
my pleasure, man.
It's funny. I said a little quote to you before we started, but this is from Chip Wilson, who was a founder of Lululemon, and he said, if we create enough innovation, the media will find us.
Mm-hmm.
And you, my friend, you're helping us do that. And Softwave and the OrthoGold 100, its time has come, and people will. This will be consumer driven. I've been saying this for 2 years now.
I 100% agree with that, man. 100%. People don't want to do drugs. They don't want to get on opioids. They don't want, they don't want to watch their loved ones slowly fall into, to
pain and suffering. Listen, it's true, man. This is non-invasive. It's same day procedure. We've actually have a patent pending protocol for 10-minute treatments. So it works. It's reproducible. We've placed this in close to 300 clinics now. We're getting predictable outcomes. John is, one of the first people that really his family stepped up and said, what else do we have?
Yeah.
And, watching my mom, it was like this brilliant woman who had a master's, she became a child and an infant. It's like they regress, and he's coming back.
Yeah.
And
you can have hope for that. That is, we can't say, hey, everybody that we do this on is going to have these kind of results, but to have a potential for that, it gives people hope. It gives, whereas they were hopeless, she was just trying to get the guy out of pain so that he wasn't moaning and groaning. It's hard for you to watch a loved one be like that. But now she's got her husband back,
Yeah. And her daughter has her dad back, and hopefully it continues. Right. And this is something that we're building on, and nutrition has got to be a part of it.
Right.
A ketogenic diet with low inflammation and intermittent fasting. And, we have to feed the body properly. And so
we combine, when we're working on we're combining postural things, because there's this whole posture that's associated with dementia and brain deterioration. Exactly. The Parkinsonian gait, head down, arms at side, stooped, flexion forward. So, we have them sitting up, we have them standing up, we have them raising their head. We're activating those pathways in the brain, because what happens is the brain is, it's dependent on two things. It's dependent upon fuel and activation. Fuel is oxygen, it's glucose. Activation is movement, basically. That's the biggest stimulus to the brain.
Yeah, your body lives, every organ, even including your brain and your heart, live from motion. So the last thing I'd say, and I think this is an important part, and again, it's my opinion, the statin drugs, I think, are really tough for long-term use. And you have to understand that, cholesterol is necessary. It's a building block for all hormones. And 60% of your brain is fat and cholesterol. 70% of the myelin sheath that protects our peripheral nervous system is fat and cholesterol. I think that's one of the first things. And the other thing about statins that I'll throw out there to our providers is it is an anti-angiogenic drug. It stops the formation of new pathways. Everything we do in our clinics are trying to promote circulation in new blood pathways. So, they should be off that if they're going through any of our protocol. Dr. Mike, really a pleasure. Please give my kudos to your team, a wonderful group out there.
Thank you.
And thank you again. You're also one of our national certified trainers. I mean, you have just helped me on this mission, and I don't have to fly across country now.
No, appreciate it. Hey man, the more people that we can get this introduced to, the better. It's going to change people's lives.
I'm
happy to be a part of it.
Thank you, brother. Thank you.